All right, Amy, thank you.
Thank you. Welcome back, everybody. Thank you so much for joining us again. We are going to start this session with the amazing Colonel Wanda Wright and have her kind of discuss some of the information that she has gathered, and then we'll go into our second session or second part of it. I apologize, stumbling over my words. Wanda, if I'll take it off to you.
Great. Morning, everybody, again. It's great to see all the numbers. Don't see you, but I see all the numbers. So I'm glad that people showed up to my presentation. I appreciate it. For those of you who don't know me, I'm the director for the Arizona Department of Veterans Services. I've been in the position for about 7 years. I am an Air Force retiree after 26 years of service, and I'm very proud of that service, and I enjoyed all of my time in the military. So it just sort of made sense that I would sort of pursue work with veterans after my military service. So I love my job, and I really enjoy working with veterans and working with my team to support veterans. I was just hearing about Flagstaff. We have some outreach people up there too who are working with those that were affected by the fire, and it was pretty devastating for some people. So please keep them in your prayers. All right, well, today I'm going to talk about transportation needs. You can go to the next slide. We wanted to address transportation needs for veterans in Arizona based on some comments that we heard during our Be Connected community network meetings. We kind of mentioned those in general session, that we have one in each region, and we have people that the stakeholders that attend those meetings are very informed about their communities and what's happening. And so we kept hearing it more and more often about particularly veterans who are unable to get to their medical appointments because they cannot drive and their partner cannot drive, or they are alone and they cannot drive. And trying to get to those medical appointments was very, very inconvenient when they're trying to figure out how to sort of cobble together the public transportation. So in August 2020, we began a process with Arizona State University, the Arizona Coalition for Military Families, and ourselves to put together a study to figure out what was really happening with veterans and transportation. So it's a community action project called Veteran Transportation Matters. And our goal was to be able to assess veterans from across the state and try to determine what their transportation needs were. It was a year-long process with the partners, and I feel like it gave us some data to be able to now, over these next couple of days, kind of look to see what kind of solutions we can come up with. In some of the previous breakouts, I've heard some really good things and found out some more resources, which I think is wonderful. So next slide. So in our study, over 2,000 veterans completed the survey, and it represented every county and 320 of the 368 zip codes, which is pretty significant. We have about 500,000 veterans in Arizona. And as you know, probably about, well, you might not know, about 30% of them are veterans who were Korean War or Vietnam War veterans. Our World War II veterans are really of age now where in their 90s, that there are not very many of them left. 83% of men took the survey and 16% were women. And 69% of them were over 65, which also I think was a really good data point. And then 47% of the 2,000 who took the survey, their income was $50,000 or less. And so sort of what this means to us is that, you know, we have people who are interested in taking the survey were a little older in the 65 and over demographic, because they had something to say about their transportation needs. And so 32% of them are older veterans. That indicated to us that there's about 30% that are Iraq, Afghanistan, and then another 30% are in kind of that Cold War era. And so, you know, if you sort of extrapolate that over the 500,000 veterans that we have, you know, 150,000 of our veterans probably could use a little support in transportation. And they're getting of age now where it's difficult for them to self-transport themselves. So I thought that was just initial, very interesting data. And it kind of supports some of the information that I'm going to share with you next. Next slide. So 1/3 or 30% of the veterans reporting using community transportation. So what that means is, you know, sort of public transport or private. Uber and Lyft was almost 20% commonly used. And the city bus is about 10%. The other category included family and friends, DAV. OWL is the contractor for the VA for support for medical appointments. And then we had some veterans who reported there was really nothing available in their area and they relied on walking or biking. And, you know, we'll talk a little bit about some of the medical facilities available in proximity so that you can kind of understand why that might be an option for people to walk or bike. There were some factors that were considered from least important to most important when choosing transportation. So convenience, you know, all of us, you want door-to-door service if you can get it. So proximity and effort were very, very important. Reliability, consistent and quick turnaround. And what we found with some of the comments was that they just couldn't rely on the transportation that was available to them at the time. Of course, cost of transportation can be an issue, particularly if you are sort of below a certain level of income. And then accessibility. Do they have wheelchair accessibility? Do they have cane accessibility? You know, so you can at least have room to walk with a cane or a walker. And so, you know, these are some of the considerations that were told to us through the survey. Under the category of other, veterans wrote preference, they prefer their own vehicle like most of us do. And other factors such as availability, eligibility, safety, distance, parking, and then of course, weather. Snow up in the north, right? Next slide, please. So some barriers and unmet transportation needs. 1/3 of the veterans have trouble getting to one or more destinations. Medical appointments were mentioned most often, and really that's what generated us to do this survey, followed by visiting family and friends, and then grocery store. Some of the others were other than like specialty destinations. You may not be going to your provider, but you might be going to specialty like dialysis or chemotherapy. And you know what I think about this is that it's important to get to your medical appointments, but it is also very, very important that you are not isolated. So getting out to your family and friends is something that I think we don't talk about enough. And when someone doesn't have the opportunity for transportation to get to family and friends, it is very, very isolating. And I think COVID really showed us that there's detrimental effect to that isolation. So that unmet need, I think, is another gap that we have to figure out how to fill. The barriers that they really were feeling, and half of them felt this of the 2,000, lack of public transportation, minor repairs to vehicles, which was higher than actual lack of transportation, which was an interesting point, which I'll talk about later. Under the category of other, participants wrote that they didn't have a car or available services in the area, and that disability, health costs, and weather were some other issues. And, I just want to take a moment here to just read some of the comments that they wrote. So for transportation allows people to get better health care. I think, these are comments from the survey, I think it allows people to get better health care in a timely fashion, and they can save money, less stress, whatever, things like that. So it's a service that helps people. I think transportation is important. If you start skipping your medical exams because it's not easy to get them, it takes you down a road. There are procedures I've never have done because I can't take 3 days off of work. 1 day to get up there, then have the procedure, and you've got to come home the 3rd day because there's no immediate ride home. So these are some of the survey comments that they made. And so that just sort of tells you what are some of the issues and barriers. And they experience the barriers on a daily, weekly basis at 30%, monthly at 33%, and yearly at 36%, which is fairly high percentages. Next slide. So the key findings, half of the veteran surveys reported they would benefit from more assistance with transportation to medical appointments. And as you can see, they travel weekly, monthly, or every other month to VA center at 65%, C-Box 56%, and non-VA medical clinics at 60%. And some of those are at quite a distance. And so you saw the 3-day, you heard me talk about the 3-day. It takes a time to sometimes get to these places, get seen, and then get back. Half of the veterans encountered one or more barriers, and then 1/3 of the veterans had trouble getting to more than one destination. Just a couple more comments to share. I know individuals that will avoid showing up to medical appointments unless somebody they know will pick them up. They use the VFW to look for help and get transportation instead of using the private companies or anything like that. The problem with most veterans is pride gets in the way of asking for help, which is sometimes the case. Another says, I would use public transportation for medical appointments if they were available, so I wouldn't tie up my wife when she brings me to appointments. Typically, my eye doctor dilates my eyes, so I need a driver. So my wife has to come with me, sit there, a personal ride back home or whatever, that would be cool, so it wouldn't tie my wife up. And then the last one, I had a cataract operation because I couldn't drive back. The shuttle picked me up at my house, and then there was a person that drove me back after the procedure, so it was very convenient. Without having that option of somebody driving me there and back, I might have delayed getting cataract operation and maybe not even have done it at all. So you can sort of see how this can really affect outcomes of healthcare, and which is a huge barrier to living a quality of life. And so I think as we roll through this problem-solving process, these are some of the stories that you can think of when you're trying to figure out how to sort of solve this wicked problem. It's really complicated. We were working with all of the county governments. They're called COGS. And so you've heard of MAG, Maricopa Association of Governments. Well, there's a NACOG, there's a WACOG, and they're all very interested in how their local transportation is working. What we found is it's very local, rural, it's very local, and that there isn't sort of a standardized transportation across all counties. And so, especially when it's rural, it makes it very difficult for them to find all that reliability and convenience and all that kind of stuff. We heard some really great opportunities and benefits out there from the last breakout, but there's still a gap. And so we want to really work on trying to seamlessly coordinate so that we can support people in their healthcare mainly, but I also think isolation being a big part of that. one of the things that we tried with the Arizona Coalition for Military Families was what we call D2D, and I think Joy is on here and probably has mentioned it in the breakouts, but during that process, and it was during COVID, we were at least able to sort of deliver food and do some things for people while they were sequestered at home during COVID, which I thought was very, very beneficial. But one of the concerns we found out was it was very, very difficult to kind of match up our volunteers with our veterans to try to make all of that work on a large scale. It was much easier to do it on a smaller local scale. And so these are some of the other things that I think we need to consider when we're trying to problem solve, is that it can't be a state of Arizona sort of transportation solution. It's probably going to have to be more of a local, let's fix it within this county or this city kind of solution. I'd just like to say thanks to all the COGs and University of Arizona and my staff and the coalition staff for really supporting this. It was a year-long study. We did the survey. It was out there for about 6 months. We actually did focus groups. That's where some of these comments came from, for stakeholders and for veterans. And so the data is really, really clear, and I think very accurate. And I think it will help us as we go forward in trying to solve the problems. And I guess I could take any questions before you move into the next session, if there are any.
Yeah, let's open it up for any questions before we go into the next part. As we're kind of waiting for people to type in the questions, if they have any, I just want to say thank you, Wanda. That information is very informative, and I appreciate all those real examples that you gave of how this is affecting people and what they're kind of missing out on if they aren't able to access these types of supports. So really powerful presentation. Thank you.
Thank you. It's just so crucial to the welfare of our veterans to have transportation to get to these appointments.
Yeah, and we definitely see that a lot of the folks that are living in those rural areas tend to be higher in age. And like you said, they just get to a point where they're unable to do that transportation themselves, and so many other factors that come into it. So this is a really good way to see how that's affecting it and how we can kind of see how important it is. So we did have a question. How can we help shuttle services add the VA and the C-Box to their service routes? So some of those shuttle services, like Arizona Shuttle, they'll do the airport and stuff, but is there any way we can kind of tap into those companies and see if we can add the VA C-Box or hospitals as maybe like a destination spot?
I actually think that is very possible. And it's a really, I think, good solution to do that. You have to coordinate, obviously, like we do in our collaborative efforts. But it sounds like someone was very unsuccessful in contacting the Prescott Area Service Shuttle to add the Phoenix VA to their route. It may be because it's a really long way, but I can see that as being a project that we might try to initiate. We have very good relationship with the all three VAs, Prescott, Phoenix, and Tucson, to be able to work with them and see if it's possible. I doubt that the VA will pay for those that are non-paid. And so just to be clear, the VA will only pay for certain veterans to have transportation to their spots. So what we'd really have to do is work with the actual local shuttle transportation people to see if they would be willing to take people to those places. And then we'd have to find a payee. But that's not impossible. You know, like we've all said before, we're willing to do these small pilots to see if they'll work, and then work on getting the funding to do a major project. So we'll write that down as a possible project.
Yeah, and I actually was one of the folks kind of trying to get a hold of Groom to see if who we would even talk to like throw that idea out. And they are across the country, and they do some where they have bases as destinations. and some of that sort of stuff for different states. So it might just be worth kind of reaching out. They might already have stuff in progress. So we do have a few more questions. We have one, is there a volunteer coordinator for the Maricopa County or like a central database for transportation and volunteers?
I would have to get back with you about that. I feel like the Maricopa Association of Governments has some data on that. They've done a lot of granting for projects as well, locally and within other counties. So they might be able to help us answer that question.
I also want to say the Be Connected support line can definitely help folks find different volunteer opportunities within Maricopa County or any county across the state, based on what they're looking for and the type of services they want to provide to the community. So if anything, we're kind of that, at least we'll help get you to the exact organization if there's not like a specific coordinator happening. So we have another question. When grants are being given out to nonprofits for transportation, how specific are the guidelines to get into the shuttles, or are they offered to any military person, meaning that the transportation could cover more than the aspect of health, but also cover food, social aspects, so stuff outside of medical appointments? How hard is it to get transportation for that?
So when grants are being given out to nonprofits for transportation, so my experience with MAG, they do give out grants for transportation, not just necessarily for veterans, right? It's for the citizenry of whatever county they're giving the small grants to. And there are guidelines within that. They have to show deliverables. They have to be able to sort of predict and then get the data of how many people are using the type of transportation that the grant was used for, and then prove whether it worked or not. And so most of the time that I've seen those grants being given, the grant is for the transportation. The people who take the transportation don't have to necessarily pay. And then it takes them to medical appointments and other things, other places. And so, but they were small grants for a short period of time. Our problem becomes, what's a sustainable payer for these kinds of transportation activities? And so we just funded a grant for our large grant from our department. We do large grants in October up to $75,000. And we granted, and I don't remember if it was DAV or VFW, a large amount of money to be able to use Lyft and Uber as a way and means of convenient transportation to get people to places they needed to go. And they would manage it. It was like an administrative account that the Veteran Service Organization managed, and then they would schedule the rides for their veterans. And so that was very specific. Our requirement for those deliverables are the data, like how many did you do, where did they go, those kinds of things. And then at the end of this year, their grant will be done and they will give us all that information. And then we can add that to this transportation study to continue to collect more money. The idea of the study really was to get the data so that we could start talking to local representatives in our state legislature so that they could understand sort of the implications of not having the right transportation in their areas, in their districts, in their whatever they represent, so that we could at least support county funding or state funding for the counties to be able to expand the transportation that their local areas are providing. Hopefully that answered that question.
Yeah, and then grants can just be really complicated. So there's a lot of different grants and a lot of different ways that you can utilize that money, and how you qualify for them are the ways that you are proving that you're showing that money for the reason they're allotting that grant funding. So that's something that we can definitely, I will just plug the Be Connected support line again. If you need help finding someone to help you find grants, find someone to help you fill out grants, we can definitely take that time to connect you with someone that would be helpful in that way. So I just want to point out, go ahead.
Dee's giving me the cutoff, so we got to move on.
I was going to say, thank you so much for your presentation. We always just appreciate all this wealth of information. We are going to move on to the second portion of this breakout. And then I want to introduce you all to Janine. She is going to be our wonderful representation from the governor's office to help with this whole process. So I will give it over to you. Thank you so much for joining us today.
Great, thank you. And thank you, Director Wright. Some really good information that I think would help us as we go through this solution session. And I really enjoyed the session earlier with Marzette and the information that was provided. So thank you guys for joining today. I will share my screen really quickly. Okay, could you guys see my screen?
Yeah, we can see it. Looks great.
Awesome. That's funny. I haven't used Zoom before, so now everything has moved to the side. Okay, good. You guys can see it. I can't, but that's all right. Okay.
Just so you know, too, I know people get a little lost. Your unmute and all that kind of stuff is going to be at the top of your screen now.
Got it.
And it can be hidden sometimes, so just kind of like hover and it'll drop down. So
Okay,
I'll let you go, just giving you that heads up.
Awesome. Okay, great. So we're going to do a solution session right now. And I know we have some session guests in here, including Director Wright. What we're trying to do is go over a problem, get some root cause analysis, so trying to get down to the why, come up with some solution ideation, and then taking action. And we also have Nick Ohm from GTO, who's going to be helping us with this. So to just give you a little bit more about the process. So the problem that we're going to focus on today is rural Arizona veterans who don't qualify for current VA transportation partnership programs, and disabled American veterans have difficulty accessing transportation to VA healthcare facilities. And some of the former speakers mentioned that, including Director Wright. So what we want to do, we want to get some input from you guys to really, why this is happening. So in order to participate, as we review the questions, we're going to ask you to provide your input via the Zoom chat. So we're going to collect all this feedback and lead to key themes. So why is it important to give your output? So ACMF and ADVS, we're going to use that output to plan programs and projects to help actually alleviate this problem. So your input is really important. So as we go through these questions and talk about why and coming up with solutions, we really hope that you provide that input so we can use that information to actually work on the programs and see how we can improve. All right. So our first question that we're going to ask, based on that problem statement, why are rural Arizona veterans and disabled veterans facing challenges when recruiting volunteers to assist with transportation to VA healthcare facilities? So we're really trying to figure out the why. I know we discussed some, potential whys earlier. So if you guys have any reasons why you think this is happening, we would like you to put it in the chat. Nick is going to go ahead and copy and paste those into here. So we'll have them to look at. He's going to put them on the sticky notes. So please feel free to put some, I see some chat ones coming in there. Okay, awesome. So we have a lack of volunteers. Yep, funds are not available. Oh, and Amy, I saw you put in there the long times for transportation, depending on where you're going. And I think Director Wright mentioned in her survey that people wanted, transportation to be there quickly and even for waiting and to pick up. So that's good. Appreciate that. The pandemic. Oh, yeah, some other, input coming there. Volunteerism is not as popular as many years ago. Oh, the older population. Yeah, we mentioned that older population not getting access to all of these fuel costs. Yep, no, this is good. Oh, the liability for transporting others. Okay. So that's a good question. I don't know if one of our experts on here could answer that. So when people volunteer to, transport others, is there some sort of liability or waiver they sign, or is it easy, I guess, for volunteers to do that, or do they feel like, they could come under scrutiny because they're volunteering? I don't know if anybody knows that on the call, the experts. Okay, Dee said yes, waivers are signed and background checks required. Okay. Yep, so I'm just gonna zoom in a little bit, note some good input on here. Put these on here. Okay, Dee mentioned for the volunteers, yeah, they cannot regulate the volunteer vehicle use if they're use their own. Okay, that they only required to have insurance and a clear driving record. Okay, that's clear. That's good. Okay, so as you guys are putting those in, I'll try to see if there's groups of these together that seem that they fall under the same category. So we have one under volunteers, very popular. Okay. Resources. So right here, I'm just, seeing, yep, there's lots more comments coming in. That's great. Trying to organize these into categories. This is good. Costs. All right, so I think we have some good info on communication of resources here. Lens. Okay. Okay. No, some good chat coming in there. Good stuff on there. So someone also mentioned in here, I know Dee, you were answering some of the questions about the liability. So Lyft and Uber driver liability, is that something that is separate from how the VA does stuff? Like, do we have any control over that? or if anybody else on the call knows any of the subject matter experts, just trying to see where that goes. So not educated, okay. Don't know if that one we can control. Okay, so it looks like we have a lot of stuff under the volunteers, and we can go over some of those. Communication on mileage. Okay, vehicles. Special needs, okay. All right, so what you guys see here, if you can see, I'm just trying to put them into different categories based on what people are putting in. So this is good. Your programs, okay. Awesome. Reimbursements. Okay, so costs. No, thank you guys. Just some good information we're getting here. We'll discuss in a bit. Okay, funds. Okay, reliability. Okay, we have some more coming in. Good job, guys. We're getting some good input on here. Fair. Okay, so yeah, it looks like we have some barriers in terms of the volunteers part of it. Liabilities. Trying to see where these goes. People may have to work. Low income jobs, costs, yep. Staffing. Okay. No, this is good, guys. I'll zoom in a little bit so you guys can see some of the responses on there too. And then we'll get the subject matter experts to comment on some of this. So I grouped some of these things here. In terms of access, so it looks like, in some of the tribal areas, GPS is limited in terms of getting access, also access in terms of the older population, no access to social media, and then Uber and Lyft not common in rural areas. We have a lot under, I just grouped it under volunteer constraints. So lack of volunteers in the area. We don't regulate volunteer vehicles. There's no large venue for coordinating volunteers. Liability concern for transporting others, additional insurance, logistics can be overwhelming, like for volunteers, right? To figure out, places and people. This actually would go under. So there's not one to stranger to take them and actually go under here with a little bit of a fear. So there's some concerns about fear around here, fear of the virus, not wanting people to go with them, fear of going in another vehicle. But that is another category. Just logistics, staffing and covering large areas. So it's the staffing cost here. I think that's a little bit separate. All right, so access here also news communication access. This is rural access. So senior clients don't even have access to cell phones or good receptions to even make calls, okay? This part here is looking more of a lack of communication and resources. So it looks like, communication of the resources is not very clear. Long transportation times, communities knowing that they're volunteer opportunities. So lack of communication on that. Communication mileage reimbursements. Okay. And then the other big bucket we have here is vehicle fuel concerns. So the personal vehicles might not be that reliable, as Director Wright mentioned in her survey. It seems like minor vehicle repairs was actually a bigger barrier than the lack of transportation. So yes, good point there. Yes, and some vehicles cannot accommodate clients. I think even in the first presentation in the breakout session, we saw that they had to be ambulatory, right, in order to access certain types of care. So if you needed access with the vehicle and stuff, it would be tough to do that. Okay, right. Trying to see if in terms of time here too. Okay, so this is some really good input we have here, team, and I'm going to kind of some more here in terms of cost, in terms of staffing. Okay, we have a couple more comments coming in. So we'll talk about those. So I'm going to open it up kind of, Amy, the subject matter experts in here. We're seeing some big buckets here. I just want to see if that kind of aligns with what you guys are thinking of, if we need to do some more, collaboration on here. But it seems like the big buckets we're seeing right now is lack of access, right? So just physical limitations here in terms of, land where they're located, some volunteer constraints where people in these rural areas, lack of communication, right, between public and private sector too, even people who want to volunteer, vehicle fuel constraints and costs. How does that line up with what you guys are seeing? Do you guys think we're capturing the big buckets here in terms of root cause?
I feel really good about these different kind of highlighted areas. Wanda, how do you feel about it?
Yeah, I want to add one more about lack of communication, because I think the VA isn't, unless it's already on there, the VA isn't quite as clear about what the opportunities are within their own system to support. It's just not that easy to sort of figure out. I think these are, when I look at the comments from the people who took the survey and through our focus groups, this really captures a lot of the issues that they were having.
Got it. That's great. Awesome. Oh yeah, weather. Yes, we talked about that. Yeah, that's huge up north too. Trying to see. So maybe we should do, I don't know if we want to do like physical access and then okay, trying to, then I will put okay, I'm trying to put weather underneath here. So volunteer constraints. I'm going to call this trying to think about the fear of not getting I know you almost mentioned a little bit of that, Director Wright, about not wanting a stranger to take them. There's some fear around that too. Fear of going into the vehicle by themselves. Yeah, so that's actually whose concern. I mean, I don't know if we could.
I think you can say concerns.
Yes, I think it's a valid concern, Yeah. And yeah. It has more fear of, fear of using, I'm trying to word that in a way, so it's using other stuff and then fear of the virus. Okay, so I'm going to put some fear of so yeah, because I guess that's the other concern too in the prior presentation where they mentioned that, they had to reduce the number of people going in the cars because of COVID. So we're trying to combine that with some COVID issues and also fear of, using the vehicles by themselves. Safety concerns, especially. So there's some fear. I think that safety concern kind of goes a little bit of the, limited cell phone errors. Okay. No, this is a good start here, guys. I think we got some really good input on here. So the next part that we're going to do, just kind of do these real quick, is we're going to take these that we see as, potential things that we want to look at and come up with some possible solutions for this. So really good input here on volunteer constraints, cost, just a lack of communication, and vehicle or fuel stuff here. So thank you guys for providing all that input. It's really going to help us here. And what we want to do, we have these big buckets. So they seem to focus on, for the veterans themselves, right? Fear of access issues, physical access, right? So based on they're really far away, really remote, cost, volunteer constraints, lack of communication, and fuel. And what we'd like to do is in the chat, once again, using the chat, if you guys could think of what are some possible solutions that would help address these root causes. So based on these big buckets we have here, and look, Joy just mentioned, to reduce the fear, some background checks with assist, right? So what are some things that we can do to particularly, in terms of solutions, address these root causes? Feel free to type in the chat again, because we have some really good input input from before, and I think we'd love to have some more input on what could we do, some possible solutions. So, and you guys in the veteran communities too, if you guys are, facing some of these, please feel free to give us some possible solutions here too. I think that'd be great. And as I mentioned before, this is really helpful to us because as we see what the solutions are, and we're trying to implement some of these, we're going to use these ideas to help alleviate this problem. You're getting some good input on the chat there. Yep, just local public transportation to send out. Yep. Great. I'm gonna read some of these as they come into. Nick, thanks for all your help putting all these together. There's some solutions here. Navajo Nation cell towers and paying, subsidizing the communication powers. Yep, that was some things that were identified in terms of rural area and getting access. Finding ways for rural individuals to get their information. This is good. So we have some good suggestions here in terms of internet communication. Communication here. No, this is good. Good information here. Yeah, we even have here educational seminars in the community. We talked about that issue with the lack of communication. Yep, that will be huge. Oh, this is a good one here too. A paid employee who's a coordinator that can communicate with the volunteers. So that person that kind of knows everything that's going on and could coordinate pretty well. That's a good suggestion. I don't know if we currently, so we talked a little bit, I know in the earlier session, Marquea, a little bit about, resources and everything available. Curious what you think of this suggestion. I know you guys are trying to find volunteers. I don't know if that's even harder with, having a paid person in there. Any feedback from the experts on this one?
I feel like it's always a good thing to have someone paid to kind of coordinate, right? Because that's their job. And it makes things a little bit easier for the program to have someone like that. The problem is, like I mentioned before, there are actually a lot of public transportation available. It's just coordinating it in such a way that veterans can get to the place that they want to get to in a fairly quick way, right? Convenient door-to-door quick way. So we also have to think about that. It's like, what are they coordinating? Are they coordinating their local county? Are they coordinating their local city? And so that's really where it gets a little complicated.
Got it. Okay. Yeah, so we do have quite a few that talked about individuals to help coordinate those. Okay. Know each other. All right, so this is more about communication improvement. This one also said to try to get people in the same area knowing each other, to have their appointments on the same day, to help eliminate multi-days. Okay. Lots of more coordination, but at a local level too. Okay. Also incentives to get them to try it once. Oh, so in terms of the fair part two, you get a little bit of incentive to try it once, and then it wouldn't be that bad, and they would probably want to try it again. Okay, that's a good suggestion here too. Educational seminars in the community. So there's one here that says support IHS and VA. IHS, could somebody describe what that acronym means? I know one of the subject matter experts here might know that.
Indian Health Services.
Got it. Indian Health Services and VA clinic development. Okay, on the reservation. Got it. Now this is good. All right, so in terms of the big buckets, I'm trying to put some of these together. All right, so we have a lot of people, well, three that say about a community engagement or individual. Okay. Interesting. So I'll just score that. Services. Okay, so this, I'm going to call this one. Oh, look, this is a good one. Develop relationships with companies like Discount Tire, mechanics to provide vehicle repair services. That was one big thing that we saw with vehicles. Yep, that would address that. Good. Agencies, mobility managers, seminars, centers. So like the ones that, so it looks like we could do some good partnerships, just even locally and with the VAs, some support on there, which is great. Transportation. Oh, these are specific contracts with developed or existing agencies for veteran transport. That's good too. I like this. So this is even with the communication, I would say this is a collaboration between agencies. So collaboration between, this is good, veterans, locals, and agencies. This is good. So, see a couple more coming in. We'll see good input on here. Yeah. So it looks like some of these, even for the public transportation director mentioned, you know, we have some of this stuff here is like coordination between what's existing and getting that information to them. Managers, I like this too. Mobility managers and agencies, a potential coordinator role. This one here said, not sure if it's a possibility. However, there's a way to tie in different apprenticeship programs for ways. Okay. Apprenticeship programs that can use towards their program requirements. Got it. So this is addressing kind of the volunteer. I do like that.
Yeah, but if it's apprentice, it will be paid.
Got it. Okay.
Yes, so that's a really great idea.
Got it. So I realize a lot of this we talked about, you know, volunteers. Have we ever looked into paid, or is that something that I know we described before, like funding isn't a barrier?
Yeah, I mean, you know, like we talked about in the general session, there are times where we can pay for things to at least test it, right? So if we were to do that and create kind of a AmeriCorps or apprenticeship, you know, we could pay for that for, let's say, a year. We would do something like that. And then if it turns out to be a really good thing in one area, then we can start talking to like NACOG and MAG and those guys to see if they'd be willing to support something like that based on the data that we get. That we were able to, get these many people, this many rides, and it helped them with their healthcare and any other social determinant of health that we can address. It's always possible because there's always grant money out there for stuff. And maybe they might be willing to have at each county or at least each COG, someone to do that for veterans.
No, that's great. These are some good, good suggestions here. I saw someone put in there, drive for tuition, joking, not joking. Drive, help for my tuition, right? You get paid and you could help. No, that's some good suggestions here, guys. AmeriCorps pilot. Yeah, I really like this. So we'll try and get a little category for this one here. So it's going to look like, I'm going to duplicate. So I'm going to call this. So versus volunteer, there's some good options here about apprenticeship, AmeriCorps as a pilot, stipend drivers. So, yep, you have a driver and, obviously meeting the requirements. Stipend drivers, yep. No, that's really good ideas. A stamp card every 10, right? Gives you a free checkup. Okay, Amy had a funny joke on that, but no.
Thanks for thinking I'm funny.
It could be incentivized pay, right? You transport these amount of people and, you move a bit.
I would do that.
Yeah. Right. And I like, because somebody mentioned here, just partnerships with Discount Tire or something, right? So if we create those partnerships, I like this as a paid opportunity. You go through that every, 10 rides, you get a free checkup with, a partner. Yeah. Ooh, a Tesla corporate initiative. There you go. You want to test out some, what about those self-driving cars, right? No, just kidding.
That is the future.
That is the future. We can be like, we're testing it out in the rural areas, but you have somebody there, That's interesting. Perhaps tap into, I like these. Yeah, a lot of good ideas. You guys are totally coming up with some good suggestions here. Yeah. So I'm going to call this one more education here. There's some good thinkers in this group here, coming up with some really good ideas here, guys. Well, there's a stipend and mileage reimbursement and meal voucher. Got it. And Dee also mentioned there's tuition assistance is a program through AmeriCorps. Interesting. Okay. Wow, so there's a lot of really, really good ideas here. So I think you guys even address specific actions that can be taken and who. So I'll go over this really quickly because I think we could pull some of these down in here too. So for you guys, really good input, I think education and incentives to the veterans. So especially I think addressing the fare, right? So if they give them an opportunity, an incentive to try it once, right? And they try it and this is great. Education, right? In the community so that people know what's going on and they're aware of the opportunities. I think that's really, really great. I really like all these here that you guys have just with incentives and partnerships, right? So working with gas stations, gift cards, discounts, develop relationships, right? So developing relationships with other companies who could provide, even when Amy was saying that joke, but, seriously, if it's something where you can partner and after a certain amount of rides, you get, something like that, I think you'll probably even get more volunteers and get more recruitment, which is great. Yes, and support, clinic development, the reservation, that would actually, so you cut down on transport, right? So if you actually have something that's closer to you, you could reduce your cost to go there. A lot of suggestions on improved communication. So just from the cell tower way, just finding rural individuals to get together, that strategic communication with individuals. Yes, internet access, right? So in a lot of these rural areas, it's hard to get internet access, hard to get phone access to call in even. So no, this is some really good suggestions here. Awesome. And then coordinating public transportation, as Director Wright mentioned, I think we have some of these, available public transportation opportunities. We're just not, putting people in connection with that and having them be aware of that, and using technology to coordinate that would be really great. Here we have a lot of things here about stipend opportunities, just, having a lot of good stipend opportunities here, paid opportunities for folks. Yep, somebody put here electric cars here. Wow, we have a lot of good suggestions here. So I'm going to move this up here. So I think these coordination opportunities are really specific and great. And we can even move some of these down, I think, to potential actions that we can have. And I'm going to just zoom in here a little bit. We have a lot about a potential coordinator role, a paid employee, some sort of, mobility manager, really good stuff here. Internship credit, somebody mentioned this here for social work students at ASU. That is a really good idea. I like that. Wow, you guys are coming up some really, I think, actions that we could potentially take, which is even the next session. So I'm gonna have to move some of these down here, which is great. Auto repair or trade school students work on, oh, this is great. Partnering with CDL programs for communications. Awesome. I like where you guys are going with this. This is some really good suggestions here, guys. I think like there are even things that could be actionable on here. So our next session, actually, you guys are almost jumping into what we wanted to do, was to come in with like, specific actions that can be taken by who, but I think a lot of these could be pulled down here. So I'm going to pull down here some of the things that you guys already mentioned. While I'm doing that, if you guys have additional certain actions that, and who, because I think some of these actually said, partnership with CDL programs, right? You guys have mentioned a couple of folks, including AmeriCorps, which are really great. These are specific actions. So I'm going to start pulling some of those down into here because they are specific actions we can take. And if you guys come up with any more, Nick has been great adding these in the chat. So feel free to add some more in here because I feel like some of these are specific things we can do and we can discuss some more about it. So I'm going to pull some of these on here. I'm going to duplicate them before I pull them over. And then just put the specific action in there. So if you guys mentioned a specific action in here, put it down here so we have it. Yeah, you guys are doing some real good solutioning here. So I just want to make sure I capture these here that are specific ones here. Great. So don't mind me moving around here, but I really do want to capture some of these, and Nick is going to capture some any more that you guys see specific actions. And then if you have like a specific person in mind, so this person could specifically do that, because I think in the session before you guys, and I'm going to put it specifically as that. Great job, guys. You guys are doing some really good work here. I'm going to pull some of these down here that were specific. Gas ones. Program. I like this stipend. Okay, this one's a good one too. Sorry, you guys can see me moving back and forth. This is great. I like the specific actions we could work with here. And I'll go back to our experts in the room. Are there particular ones here that you guys feel really strongly about, that these are really good? We can move them down as well. And Amy, just to keep us on point, this session ends at 11:20. I just want to make sure we're okay. Great. And we're getting good input here. I just don't want us to go over time as well. Thank you. Like these. Coordinate. Yep, I'm looking at some of these. I like these. Try to make these blue. Thank you guys. We have some really good specific actions on here. Cool. And some of these I'll just take down as the top ones here as the coordinator role. Develop coordinator role. Good job, guys. You guys are getting some really good input here. And these could be specific things after this. So your input is really important because we're going to use these to figure out how we could, make this program better. So you guys are doing a good job on this. Yeah, we have some good ones here. To create MOAs and MOUs with the organizations that we are mentioning and have them actively participate, not just say they're partners. Good input on
That's a
that.
good one.
Yeah. I think that's a specific thing we can work with. Yeah, because it seems like, yeah, we can identify partners and work on that. So I'll just put that as one of the, I'm just going to put, yep. Mm-hmm. So I think this captures a lot what was done before, just in terms of identifying, specific partners that we could work with. And with that in mind, I know we kind of mentioned, I put a couple down here with ASU, brainstorming some more in terms of, we mentioned these MOUs with organizations. If anybody wanted to add any specific organizations that they think we should work with or have experience working with them, I think that would help us, because in terms of reaching out, are they particular organizations you see us working together with? We put in up there like a Tesla Corporation, CDL training programs. We had AmeriCorps in there, internships with ASU. Any specific actions or partners you guys could identify that we can possibly work with, that would be great too.
Yeah, I think somebody mentioned the COGS, the councils of government.
Got it.
That they have transportation component within their councils of government, right?
Okay.
The COGS. And so that definitely, I think that's like low-hanging fruit that we can, and they're the ones who also offer some granting.
Ah, okay, good.
So I think that's it. That was a very good one.
Okay, I'll put that there. That's great that they have grants too. That's awesome. People could provide money and work on that even better. Awesome. Oh, so somebody mentioned here that they're in the process of expanding. I'll make this a little bit bigger. MOUs with NAU Senior Service Corps programs. That is a pool of volunteers. Wow, volunteers that are trained and equipped to support. However, we need to get them trained or educated on military culture and open to become drivers to medical appointments. Okay, no, that's great. And I really like that you guys are addressing kind of the military culture part of it too. No, that's awesome. We have a couple more coming in there. College and university vet centers. Okay, that's great. To recruit military connected students as driver volunteers. That's great. So Dee mentioned that. I just see it in the chat still. We have attempted but not successful. Okay, perhaps additional tuition. Okay, I saw that one right here. There. Okay, so that's a good one here too. So yeah, I really like that. They have attempted in the past but not successful. So maybe some sort of tuition assistance, or yeah, I can see a college student, oh, you can get a free thing for your, car or something after that, or like those partnerships with even the local auto repair shops, right? And I'm working with them to get something in there. It's really good. We'll have the faith community help with transport. That's good too. Yep. I know we have like volunteers who'd want to volunteer for that. And as you said, I feel like some folks have really good connections with the veteran community and one will help with that. So that's great. Yeah, I think part of it too, and I know we mentioned the communication up there, and we can bring some more down from up there too, that we talk about the improved communication and coordination strategies. I think that's going to be huge. I think with the rural communication and getting collaboration between agencies, and to see if there's any, we did talk about these here. But yeah, really good suggestions, guys. I think we have some really good things on here. Working with the COGS, developing the coordinator role. Credit. Right. I know, Nick, you're doing a great job adding all these keys in here. We have like a lot of input here, which is awesome. Relations come trends and with mental first aid training. It's good. It's good advice. Okay. No, this is some really good input. I know that you guys, all the subject matter experts on here too. Hopefully it's a little bit helpful what you guys were thinking of. Anybody want to add some input? Amy, Director Wright, I know there's some good input on here, even above on here with potential actions that can be taken.
I don't have any.
Yeah, I mean,
input
I
this
feel like
amazing.
they're really filling in some of the, you know, you want a little low hanging fruit. I think
Yes.
the idea with, you know, working with the local transportation, let's just say in Prescott, for instance, and trying to really discover or do some asset mapping that we could actually create a brochure for the veterans in that area. Here are all the transportation options that you have, you know, maybe based on eligibility or something. You know, here's services that cost if you're not necessarily going to a medical appointment, but can get you to the movies. You know, that might be a little cost, but if you're going to your medical appointment, maybe there's things that we can get done that would be obviously no cost. So, but you know, they're grassroots efforts that really take time and coordination.
Coordination. Yeah, no, that's great. Some really good suggestions too. But yeah, no, that would be awesome. Like a veteran could, you know, show up, have this piece of paper that says, hey, for this, you can use this. And yep. Awesome.
Yeah, because that was a very big complaint in the survey that veterans just didn't know what was available in their community.
Got it. Got it. So providing that information, yeah, would be huge.
Yes.
Okay. Appreciate that. Oh, the mayor, somebody just had a suggestion. May want to reach out to the mayor in Prescott about that option. Okay. This is good. So it seems there's lots of opportunities. I think like we have some existing information, probably, you know, as Director I was mentioning, compiling that information and working with these local groups to partner with them and figure that out. So, you know, this is great. It's like you're saying, Director, right from your presentation before, we have these gaps and we're trying to fill these gaps, and we have some, you know, potential opportunities and solutions here to fill those gaps. So this is great. And like, you know, we've called out, you know, potential specific partners that we can go and research and see if that's an opportunity too. And then we have existing partners that you mentioned, Director, right, in the COGS, and then, you know, these groups that we work in. And then there's one right here that says, you know, at a NACOG meeting, the COG meeting, we were recently made aware that 300 vehicles exist. Wow, that could be coordinated. Okay, so it looks like, you know, there's opportunity with existing resources to even, you know, work on alignment and calendars. Wow, that's like 300 vehicles, right? So if you get I don't know, trying to put these together, and AmeriCorps volunteer could drive those vehicles already in existence. It looks like we have a lot of good opportunities there, right? Or a social work student at ASU, and, you know, they need to have some volunteer hours. Hey, we have these vehicles that are available. No, that's great. And then partnering with the local community to offer, like, you know, the repair part of it. I think that was mentioned too, right? Like a lot of the veterans, they just need minor repairs on their vehicles. If there's an opportunity to partner and do that to assist the veterans, this is great. Awesome. Oh, and I seen the chat Scott put in there, he basically said that Yagafai regional, a regional transit provides free rides on their limited bus routes for riders with a veteran designation or their state ID or driver's license. Okay. Yeah, so I think that was getting back to Director I mentioning that whole thing about the public transportation, right? Like I don't think they're aware of that public transportation availability. Okay, no, that's great. All right, we have a 2-minute warning. I think we have a lot of good input here, guys. This is some really good work here today. I think you guys are definitely thinking outside the box and trying to connect those dots together to the problem and getting it down to specific actions. So that's super awesome. I appreciate everyone here, these presenters, Director Wright, Amy, everybody just kind of providing input. You guys are so valuable here. All this input that we got from you all, super important. I really appreciate the input. This has been a great session. You guys are helping us with your brain power to help figure this out, which is great. And we're going to, as you mentioned before, use this to help address this problem. So ACMF and Veteran Services are going to work together and see from all this information provided what we can put into action. So this is really great. Thank you guys so much. And anything else you want to add, Amy? And thank you, Nick, for helping out with all the stickies from the GTO end.
No, thank you so much, Janine, for all your work and everybody typing away in the chat box. Everyone, it's so amazing to have this opportunity for all of us to be able to really collect this information. And we appreciate your team taking all this information and kind of organizing it for everybody and giving that output. Because yeah, like we've said a million times, it takes all of us and we're all having to work and coordinate. And these are those first steps to really make that kind of coordination happen. So thank you so much. What an incredible breakout this was. I think all our brains just grew a couple sizes.
Yes, yes, I am very pleased with this, very pleased. I think between the coalition and the department, that some of this will come to fruition. We can't do all of it, but we can do some of it.
Yeah, we can definitely start making those things happen. But yeah, it takes a while, but this is how you make it start and this is how it makes it happen. And Arizona is rare in this ability to have these conversations. A lot of people aren't even doing this. So we're really thankful to be able to have this group. Wanda, always a pleasure to hear you speak and have you present. So we do have a little bit of a break, everyone, until 11:30. So stretch, do what you need to do. We do have a closing session so that we really would love you to attend. You don't want to miss any of Thomas's jokes. Make sure you're writing them down so you can tell them at parties later, because we know that those are very valuable. And then we will have a little bit of a lounge at the end and kind of network. So all the wonderful people here can talk to each other and exchange information, that sort of thing. So I will put the link to the general session in the chat box. So otherwise, thank you all again for attending. And this has been a wonderful breakout.
Thank you guys so much. Take care.
Thanks.
Bye.
Bye.